This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Dr. Ben Kornitzer, MD. He is the Chief Medical and Quality Officer for Agilon Health, an organization that champions the roles of independent physician practices. Dr. Kornitzer is board certified in internal medicine, and his clinical practice focuses on primary care for high-risk, homebound, older adults. Dr. Kornitzer, thanks for joining us here today on eHealth Radio.
Oh, it's a pleasure to be here with you.
Hey, and we certainly appreciate your time and for coming out today as well. So a great place to start. Tell us a little bit about you and your background. That would certainly lay a good foundation to kick things off today.
Sure. So I'm a primary care physician by background. Did my training in New York and in Boston. Actually originally a native of Boston. And, while I was growing up, I had, two busy career-oriented parents. One was a physician, one was an attorney. And so was, largely raised by my paternal grandparents who, were in their 70s and 80s. And so as a young child, really got to have a deep appreciation for that older generation and their healthcare needs and, just where those relationships were. And that really inspired me to go into medicine. And in medical school, I just found a natural connection with the geriatrics department, and my mentors as a medical student were in that department, and I really tried to focus my research, my interests on the care for patients over the age of 65 and, how older adults were dealing with serious illness, with medications, with all the social determinants of health. And my entire career has really focused on that. So, after finishing my residency training, I worked for a consulting company, McKinsey, where we spent a lot of time looking at, different health systems and how they're working, and older adults and value were really a central part of that. And then after finishing that work, started my own house calls practice, where I would go with a backpack in New York City and see homebound older adults, and really try to understand not just how I could provide better care for those individual patients, which was unbelievably meaningful, and I've kept a relationship with many of them. But how do we make the healthcare system better? How do we find those patients who are sort of lost to care or are afraid to come in or don't have the financial means for their medications? And that naturally transitioned to the work that we're doing right now at Agilon with independent physicians across the country.
I certainly appreciate your sharing your background with us and some of the highlights there, and it makes a lot of sense why you chose this profession as well. Now, tell us, I'd be curious from your perspective, how have doctors been influential in the COVID-19 vaccine rollout? What is a white coat influencer as well?
Yeah, there's nothing more valuable in terms of, a healthcare intervention than the relationship between a physician and their patient. And, especially, with the Delta variant, beginning to really run rampant across the country, we had seen significant vaccine hesitancy from patients before. And I think these trusting relationships between patients and physicians is really going to be how we bridge that. Physicians are seen as, among the most trusted and, valued member of our society. And we have longitudinal relationships with patients. We help them with all sorts of, life-defining decisions, what medical therapies they should try for, how to sort of better manage their health, what are good preventive screening activities. And so COVID is no different than that. And I think using, our relationship to understand, how critical vaccination is, not just for the patients themselves, but for their loved ones. And so one of the things that, we did at Agilon is we actually created a series of videos where physicians from around the country, showed that they themselves were getting vaccines, that they were rolling up their sleeves and urge patients to do the same. And, we were very thoughtful about it, right? What are the things that patients want to see from their physicians? Well, they want to see that these are people in their community. And so we had doctors from all over the country. They wanted to see, physicians who spoke their language. So we had it done in English. We had the sessions done in Spanish. They want to see that their doctors look like them. And so we really found physicians from different genders, from different backgrounds. And then we made sure that we really advocated on what the science was, right? This is, unbelievably safe. The bad outcomes are really measured in like 1 to 2 per million. Your chance of dying in a car accident or by a lightning strike, is significantly higher. And then we also emphasize the fact that, patients of all backgrounds were really involved in the clinical trials that allowed for approval of these vaccines. And in fact, many of the physician partners that we worked with were participants on the research end, which is absolutely critical as well. And so I think that that relationship and the ability to influence our patients to healthier behaviors is really a critical part of the solution for this pandemic.
I certainly appreciate your input and feedback there. So important and very helpful as well. Now, we know that the U.S. reached its goal of vaccinating 70% of U.S. adults. Can you share your thoughts on the significance of that milestone?
Listen, I think that we've done, a phenomenal job as a country. I think we honestly came off to a relatively slow start initially at managing COVID. I sort of think about to paraphrase the Winston Churchill quote, Americans always get it right after trying everything else first. And so slow start in terms of, controlling the pandemic initially, but, really one of the fastest rollouts of a vaccination anywhere in the entire world. And this was something that was done on a bipartisan basis. So, these were vaccines that were, initially developed under a Republican administration. They were largely distributed under a Democratic. So, this has been just a, tremendous, national effort. And, the fact that we've, gotten 70% of adults vaccinated is great. We still have a long way to go, though. I mean, really, I think this last push, this last 30%, may be a heavier lift, in fact, than that initial 70%, but it's so critical for multiple reasons. These patients are the ones who are going to be most vulnerable. These unvaccinated patients, also will be really a reservoir for continuing the spread of COVID. And so, I just am so appreciative of all that we've accomplished so far, but this is definitely not the time to rest on our laurels, particularly with the Delta variant increasing in prevalence. So, strong work to date, but some real, work still ahead.
Yeah, for sure. And like you said, the 30% could be a harder lift than the first 70%. Today we are with Dr. Ben Kornitzer, MD. He is the Chief Medical and Quality Officer for Agilon Health, an organization that champions the roles of independent physician practices. Dr. Kornitzer is board certified in internal medicine, and his clinical practice focuses on primary care for high-risk homebound older adults. And he's joined us here today on eHealth Radio's Health News and Healthcare channels, a part of the eHealth Radio Network. Now, what about the hard-to-reach folks, maybe those who are elderly or technologically challenged? How can doctors best promote vaccine acceptance to this demographic?
Oh, and that's going to be absolutely critical. And as you can imagine, those are the most vulnerable patients and the ones who probably would have the worst outcome if they wound up getting infected. And so what we're able to do, because we have really rich data on our patients, so physicians know who's got heart disease, who's got pulmonary disease, who has diabetes. So we were able to use our database to actually identify which patients were at highest risk, which patients were also probably going to be most challenged at getting into the physician offices. So we had a centralized team of nurses. They were actually based in California, but they were able to call patients across the country answer any of their questions about the vaccine, help arrange for either visits to an outpatient setting, or even in some cases, we have the capability, for example, in Columbus, Ohio, our partner there has a team of nurses that actually specialize in doing home visits. So we were able to go into people's homes and administer the medication there. But really, as I said earlier, it's getting to those hardest to reach patients, which is going to be sort of most impactful. And so I think that, the average physician has often been trained to take care of the patient who's in front of them in the moment. One of the things that Agilon and our partners have really focused on is how do we help those patients who aren't in front of us at that moment by thinking about patients, as part of an entire panel that a physician really has to manage. We can think about who are we worried about and making sure that either we're calling them, we're sending nurses out to their home, but there really is, a remarkable ability to help those patients, because we have those deep relationships through healthcare, and it's part of our role as physicians.
Now, another question for you as well along those lines. What is the Roll Up Our Sleeves campaign? Get into some of the details there.
Yeah, so, the Roll Up Our Sleeves campaign is a campaign that we did with practices around the country. It was all led by physicians. We had a website that patients could go on where they could see what the most up-to-date, clinical guidance was about the medication. They could see videos of doctors from their own community. In fact, oftentimes they saw their own primary care doctor explaining why the medications and the vaccinations were so critical for the treatment of COVID. And then also, the whole notion of physicians as influencers, right? They are a trusted voice in our country. And so physicians were saying, listen, we're rolling up our own sleeves. Shouldn't you as a patient do the same? We're doing it for our loved ones. We're doing it so people can go to concerts again, so we can hug the people that we care about in our lives, so we can keep people safe, so we can get back to the things that really make life so meaningful. And that resonates with patients. So hearing it from physicians, there's no better message saying that a vaccination is safe and the right thing to do than by role modeling that behavior and showing our patients that we as providers, in fact, are getting vaccinations ourselves.
Dr. Kornitzer, really appreciate your visit with us here today and for what you do, and thank you so much for your time today. Before you go in conclusion, any closing thoughts, a takeaway, a tip, or anything else you'd like to add as we do wrap things up here today?
Yeah, what I would say is that, every generation, right, has something within healthcare that really has the opportunity to transform the world, right? You think about, the thousands of iron lungs that were developed, to treat polio, and then, the polio vaccine came out. You think about the amazing work that was done, in the 1990s to really begin to get a better handle on the HIV crisis. With this global pandemic, this has been a huge challenge for our country, for patients, for physicians, but doctors are rising to the challenge. And, it's demonstrating more than ever that relationship between the doctor and the patient, the fact that our doctors are in the communities, that they're there, that they're listening, I think it reaffirms everything that we believe in as doctors. And I think it really, lights the way to hopefully a much better future.
And I'd say that's about as great as a place to conclude today. Thank you so much, Dr. Kornitzer, for those final words and advice. Where can listeners get more information on Agilon Health, and how could they be in touch as well?
Sure. So they can go to agilonhealth.com and, find out about what we do as an organization, about our partners, and, how we view value-based care.
Again, Dr. Kornitzer, we want to thank you for your time and for joining us here today on eHealth Radio. Listeners, it's agilonhealth.com. Dr. Kornitzer, all the best, and thanks for joining us here today on eHealth Radio.
Thank you so much. Enjoy the rest of your day.
And you as well. We've been speaking with Dr. Ben Kornitzer, MD. He is the Chief Medical and Quality Officer for Agilon Health, an organization that champions the roles of independent physician practices. And for all the details, visit agilonhealth.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.